Implementing safe practices. Establishing safe practices is fundamental to enhancing patient safety within healthcare settings. This involves the development and strict adherence to standardized protocols designed to minimize risks. Healthcare institutions should implement evidence-based procedures that are regularly reviewed and updated to reflect new findings and technologies. Staff training is essential in embedding these practices into daily operations. Regular workshops and simulations should be conducted to ensure that all healthcare professionals are well versed in the latest safety protocols. Constant evaluation and documentation are necessary, allowing organizations to identify areas for improvement and thus reinforcing a culture of safety. Roles of healthcare professionals. Healthcare professionals play a pivotal role in promoting and maintaining patient safety. Each member of the healthcare team, from physicians and nurses to support staff, must understand their responsibilities in preventing harm. Professionals are required to maintain a high level of vigilance and commitment to safety protocols. Effective communication within teams is critical, as it ensures that information regarding patient care is accurately conveyed and understood. Moreover, healthcare workers must foster a culture of openness where concerns can be voiced without fear of retribution. In this context, leadership is crucial. Leaders must model and reinforce safety-oriented behaviors and attitudes. Technology and patient safety. Technology serves as a crucial component in advancing patient safety. The incorporation of electronic health records, EHRs, has streamlined the storage and sharing of patient data, significantly reducing the occurrence of errors related to manual record keeping. Decision support systems assist healthcare professionals by providing timely reminders and diagnostic suggestions, enhancing decision-making accuracy. Additionally, technologies such as automated medication dispensing systems have minimized medication errors by ensuring the right patient receives the correct dosage. However, successful technology integration requires comprehensive training and ongoing support for users. Furthermore, regular system evaluations to address potential vulnerabilities enhance technological reliability and safety efficacy. Implementing these systems with diligence contributes to reducing errors and improving overall patient outcomes in healthcare environments. Patient safety strategies and innovations. Best practices in patient safety. To advance patient safety, it is essential to implement well-established best practices within healthcare settings. These practices include fostering a culture of openness and transparency. Organizations are encouraged to support an environment where staff can report errors without fear of retribution. Emphasizing teamwork and effective communication among healthcare providers helps mitigate risks associated with miscommunication. Regular training sessions and workshops on patient safety ensure that healthcare professionals remain updated on the latest protocols and procedures. Innovative technologies enhancing safety. In recent years, technology has played a pivotal role in enhancing patient safety. Electronic health records, EHRs, for example, have streamlined the documentation process, reducing paperwork errors and improving the accuracy of patient information. Moreover, artificial intelligence, AI, is increasingly employed to predict potential adverse events by analyzing large datasets to identify patterns and risk factors. Advanced monitoring systems equipped with smart sensors alert healthcare providers to critical changes in a patient's condition in real time, allowing for rapid response and intervention. Case studies of safety interventions. Numerous case studies highlight the successful implementation of patient safety interventions across diverse healthcare settings. One notable example is the adoption of barcoded medication administration (BCMA) systems in hospitals. These systems have significantly reduced medication errors by ensuring patients receive the correct medication and dosage. Another example involves the use of simulation training to prepare medical staff for high-risk procedures. A study conducted in a large urban hospital demonstrated a substantial reduction in surgical complications after implementing regular simulation-based training for operating room staff. Furthermore, implementing hand hygiene protocols in hospitals has been shown to decrease infection rates drastically. A community hospital in New York reported a 30% reduction in hospital-acquired infections after intensifying its hand hygiene program. These case studies underscore the effectiveness of targeted patient safety interventions and the importance of continual assessment and adaptation of safety strategies within healthcare environments. In summary, focusing on best practices, adopting innovative technologies, and learning from successful case studies are crucial in advancing patient safety and ensuring the well-being of patients within healthcare facilities. Role of policy and regulation in patient safety. Healthcare policies impacting safety. Healthcare policies fundamentally shape the safety framework within which medical institutions operate. These policies aim to safeguard patients by formalizing care practices, protocols, and processes. For instance, the implementation of guidelines for hand hygiene and infection control can drastically reduce hospital-acquired infections. Effective policies provide clear instructions to healthcare workers, creating a structured environment that mitigates risks. Policies, however, must remain adaptable to healthcare advancements. A static policy fails to account for emerging technologies or evolving medical knowledge, potentially compromising safety standards. Regulatory bodies and patient safety. Regulatory bodies play an instrumental role in enforcing healthcare standards crucial for patient safety. These organizations, such as the Joint Commission and the World Health Organization, establish and periodically review comprehensive safety protocols to ensure adherence across various healthcare settings. Their evaluations and accreditations serve as benchmarks for quality and safety. By imposing stringent standards, these bodies facilitate a uniform safety landscape. They not only establish regulations but also engage in continuous oversight and assessment, ensuring that healthcare institutions comply with defined safety norms. Such proactive measures are essential for maintaining public trust in healthcare systems. Compliance and its challenges. Compliance with healthcare regulations presents numerous challenges that healthcare institutions must navigate. While adherence to regulations is mandatory, it often requires significant operational changes and resource allocation. Small clinics, in particular, may struggle with the financial and logistical burdens of compliance. Furthermore, the rapid pace of regulatory updates can overwhelm institutions striving to remain current. Healthcare professionals must be continually educated about regulatory changes to prevent unintentional breaches, a task that demands ongoing investment in training programs. Moreover, compliance should not be viewed as a mere tick-box exercise but as a commitment to patient safety. The challenge lies in embedding this mindset organization-wide. Balancing compliance with high-quality patient care calls for a strategic approach that encompasses all levels of healthcare delivery. Hence, while policies and regulations provide the roadmap for safety, their successful implementation hinges on a thorough understanding of the challenges and an institution's ability to proactively address them.